George Private Hospital and also Hurstville Hospital.
Hurstville sometimes I go, but we go to East Sydney Private, we go to St. George. There's a few places I'm very particular about, the providing good service for the patient. That's important.
And he really does provide a good service for his patient. We're going to do a quick Q&A for some questions that you guys have sent in, and we're here to answer them at the best of our abilities.
It's true, because I think there's a lot of questions that kind of personal, and the questions are generic. It may not suit everyone, and everyone's want to have surgery for different reasons. And I think it's hard to kind of fit everyone's, kind of what they want to do.
Absolutely.
But generally speaking, surgery does work. I think that's mostly what we want to say.
I love that. Well, let's get started.
Okay.
Our very first question is, do you have to be a certain BMI or a certain weight?
I think for generally speaking, everyone can do with a couple of kilo of weight loss, but there are criteria that we then suggesting that possibility of considering weight loss surgery. Western culture, BMI more than 35 with medical problem, or BMI more than 40.
Okay.
Asian Pacific is slightly different because the disease pattern is different, and the body contour and the body distribution of fat is different.
Right.
So the BMI range can be 2.5 lower. That's the international recommendation.
Okay.
But I think that what we will say, generally speaking, the criteria for us to considering bariatric surgery itself.
Okay, I love it. Question number 2 is there an age limit when you can get bariatric surgery?
Look, my youngest patient is 16 years old.
16 years old?
Yes, my oldest patient is 70. But
Wow.
general recommendation is I try to steer away from surgery if they are teenager, basically because I think they're probably a lot more involved in terms of family issue, dynamics problems, genetic problems. Sometimes we have to involve pediatric or pediatricians or endocrinologists as well. But some of the patients, their family have surgery done, and I think after detailed screening, it's not impossible. I would say probably more than 20 years old is when their life is stable, they have good understanding about surgery, and after detailed discussion, it's possible. Now, we shouldn't be ageist. Nowadays, 70 years old or 65 years old is probably when they first retiring, want to enjoy life, and we shouldn't preclude them from surgery because we offering gallbladder surgery, hiatus hernia repair for older people. So surgery nowadays done by keyhole surgery is not as dangerous what it used to be.
Absolutely.
But again, individual risk factors is important because when you're being overweight, you can have problem with cardiac issue, blood pressure problems, and other issue that we have to be careful not to cause any problem.
Right.
But that's the rough age limit, but that is what the general rule is, but case by case basis.
I love that. Okay, question number 3. How long after bariatric surgery does the weight stop coming off?
It really depends on where you start and depending on your motivation. We do see, generally speaking, the first 6 months is the high impact time, up to about a year. But I still see people losing weight if they are willing to change their life, if they're active, if they're looking at what they eat, if they comply and come for follow-up. Sometimes I think the weight loss, when they plateau, there could be a reason. It may not be simply losing weight. Sometimes 6 months afterwards, we're not too focused on weight anymore. We focus on your body compositions, your body shape, your sizes. So there's a lot of, not just the numbers. I think the general well-being, whether your disease is gone or not, I think that will be more importantly compared to just a number. But yes, weight loss tend to slow down a little bit 6 to 9 months afterwards. But we can always do more. Yeah,
absolutely. Great answer, Dr. Loi.
High five.
I love that one. Okay, what can you do when you have plateaued, and what causes a plateau?
Now, as I say, when you're plateauing, it may not be the weight that it doesn't go down. You may still be losing fat and putting on muscle. So we have to start then training. We have to then focusing on looking at more what other food we can cut out without affecting you nutritionally. What are the time or your capacity or the ability to be able to exercise? Because ultimately, if you exercise, not only you enjoy the endorphin release, it's a good bonding, you feel like you are in a headspace, you help to improve mental durability, mental strength, but it's also help you to tone up and build up muscle. Because long-term wise, muscle is help you to burn off your fat. So you may able to eat more afterwards, but you're also able to burn off more fat.
Okay.
So I think that's more important than weight again.
And would you recommend the going back to stage 1, so the pre-op diet when you're on a big plateau?
Yeah, sometimes it's a kickstart,
Yeah.
and we have patients do that, and sometimes they may still have certain weakness in their life that they succumb to.
Yeah.
Like, I wouldn't necessarily say food addiction, but certain craving, certain go-to places for food that need to be rectified,
Yeah.
not by a surgeon,
Yeah.
by a qualified psychologist or psychiatrist,
Yeah.
and or counseling. I think that will be needed.
Okay, great. Now, do you lose more weight with the bypass than the sleeve, and what is the reasoning for that?
I think, look, bypass is additional rearrangement of the bowel compared to sleeve. Sleeve, as you know, is just limiting the portion of the stomach. Bypass not only limiting the portion, but rearrange the bowel so that you're not absorbing all the food.
Yeah.
So it's kind of got two action comparing to one.
Yeah.
But to me, I think the most important thing is still lifestyle and food.
Yeah.
I've seen people do equally good in sleeve compared to bypass.
Okay.
The general thing is the bypass do gearing more towards metabolic problems,
Yeah.
like diabetes. They do have a better chance to resolve diabetes. The study do show that they seems to be more durable comparing to sleeve.
Yeah.
But the honesty, I think, is really depending on person and patient. So
Absolutely.
So I think, but let's not forget, as a surgeon, you want to make sure that doing more complicated surgery doesn't give you more complication. And certainly, the more complex the surgery we do for you,
Yeah.
the more risk you have, either short-term or long-term. So case-by-case basis, do no harm is my principle.
Okay, I love that. How long after surgery can you be intimate?
I always tell patients, I think,
Look at
even
his cheeky smile.
I think it's like a hernia operation itself, or even I do other operations like gallbladder surgery, because anytime we do something in your body, you got to make sure it's healed.
Yeah.
So, intimacy is like exercise. So, general rule is 2 to 3 weeks until you have any heavy exercise. But the sleeve itself and the bypass itself, there's more involved because we're actually sealing and cutting the stomach at the same time.
Yeah.
So we want some extra security.
Of course.
I would say more than a month.
Yeah.
But it's not, as long as it's not bedroom Olympics, then I think it's
Yeah,
fine. Okay?
bedroom Olympics. Do you hear that?
The Olympic just finished, so Winter Olympic just coming, so it's different, okay?
All right, now the next one. All right, so a question that was asked a lot.
Mm.
After surgery, will it affect pregnancy, so the growth of a baby?
If your weight is stable, this means that your body is getting enough nutrition to sustain yourself, and as long as you follow up with our dietitian, your blood test that indicated all your parameters are good, then I think you can consider pregnancy. Most of the international study actually demonstrated that by 12 months to about even up to 18 months, you should or may be able to consider pregnancy.
Mm-hmm.
But the only cautions I told patients is that whenever you have bariatric surgery, if you are pregnant, you may not need me, but you need to contact my dietitian.
Yeah.
Because I think the dietitian for pregnancy could be different than the dietitians that we manage, because baby weight are demonstrated to be exactly the same, and maternal well-being are in fact better
Okay.
if they actually lose weight.
Yeah.
Because when they lose weight, they may not get gestational diabetes.
Yeah.
It'll be easier in terms of the delivery process, etc. So there's a lot of additional bonus.
Yeah.
So patients actually will find that when they lose weight, their pregnancy comparatively could be easier. And the baby itself, as long as the growth is being monitored by obstetricians, I think it's absolutely no problem.
Yeah.
In fact.
I love that. Thank you, doctor. Now, why do so many people suffer from reflux?
I think reflux is what we call the Achilles heels of sleeve.
Okay.
None of the operation we do, I mean, you might remember the days of lap band,
I remember.
So it's all the procedure we do have certain side effect to people, but you have to look at what the trade-off is. So for sleeve itself, because you convert the stomach from a floppy little bag to a little tight tube, so the pressure itself is go up by physics. And I think a lot of the reflux, not just because that the diaphragm get weak or there was a hernia before, we didn't fix it, or maybe there was a hernia that filled up with the fat, but when we lose weight, then it becomes loose.
Yeah.
So that's one of the possibilities.
Okay.
The other one is also, if the patients also don't wait for the signal of fullness and pack up with the food naturally will go up and down.
Yeah.
And then they'll be terming it as reflux.
Right.
But it's probably just because they wasn't aware when to stop. And if they actually slow down and reduce the amount of food they eat, not eating too late, then I think the reflux is manageable.
Yeah.
So in my cohort of patients, I think I treat a lot of other people with reflux even without weight loss surgery.
Yeah.
So yes, it's not as common as people who have sleeve, but I would say that probably 3 or 4% of population will have some sort of reflux in their life. They don't need surgery, but sleeve itself, 10-15% of people will have experienced reflux.
Yeah.
Some to the stage that I think they need surgical help, but a lot of them are medically, we can use medication to control them.
Okay,
So
great.
it's not the absolute worst, but it is the Achilles heel.
Absolutely, and it's not a reason for you not to get the surgery.
Because the other benefit will outweigh.
Exactly. Okay. How long does it take to recover, and is it quite painful?
I think keyhole surgery, if it's done right and it's done properly without a lot of adhesion, scarring, or etc., without any problem during operations, most of the patients nowadays get home 2 to 3 days.
Yeah.
After they rest up for 2 to 3 weeks, because that's the time that they learn how to manage the hydrations. They walk, they get rid of the gas pain, the shoulder tip pain that you probably have felt
with a
before.
heat pack, you'll find just keep even if the pain's not there, you keep the heat pack on, and it'll be gone within a couple of days. But I was able to drive home 2 days after, 3 hours away. Just with a little bit of pain medication, just feels like a big ab workout.
Yeah, exactly, because the body natural defense is actually stop you from moving. So I wouldn't say pain is not. Pain is an indication that yes, you have surgery, you shouldn't overdo it, and in fact sometimes I think a little bit of discomfort is okay, and we have enough medication to get on top of it, so you're not kind of rolling around in pain, you're uncomfortable, you need to rest, you need to learn how to manage your fluid, and you get over the surgery with time of the healing.
I love that answer.
So 2 to 3 weeks is kind of the ballpark figures.
Wonderful. Awesome. Now, okay, so this was a very heavily asked question. Can you go from sleeve to bypass back to sleeve? So basically, is the bypass reversible?
I think bypass, I haven't yet to reverse one bypass. We may consider one patient when they're injured or they're getting recurrent hypoglycemic from dumping syndrome. But it's always difficult to go backward because you can go from a sleeve to bypass relatively easy, but once you divide the stomach and rearrange the bowel, technically we haven't cut away any bowel during the bypass. Technically you can reverse it, but there will be difficulty because just imagine how you join back a tube together, where you're going to do it, is there enough tension, would that be a scarring problem, and you disconnect the bowel, how do you actually returning it back to the right orientation, so often can be quite confusing once you rearrange someone's bowel. I think it's generally speaking, we try not to. But is it impossible? No, nothing is impossible. We haven't divided anything. We're just rearranging things. We can rearrange it back. But have to be for the correct reason.
Okay. You heard it here first. Can you tell me what the difference is between all of the different bariatric surgeries? So I know there's the band, there's the bypass, there's a sleeve.
Well, there's actually different type of bypass for people who doesn't know. And different type of bypass means how we rearrange the bowel differently, and they all have the different good and bad thing as well. And so that bit, I think I would say talk to your own doctor to get a proper, sort of arrangement. So you look at what it is and you consult them. You ask them about the side effect, whether it's for you or not. A lot, I would say, depending on the medical problem, depending on the food they eat, the degree of weight loss they're expecting to lose, and some using it as a treatment for other side effect. Let's say if you have bad reflux to start with, and you have diabetes, maybe a bypass is better than a sleeve. So lap band, we don't do it anymore.
We don't do that anymore.
I mean, although there is from overseas, I heard there's a vertical band that
Okay.
is coming into the market and mimicking a sleeve.
Okay.
So I'm waiting for that to happen.
You never stop learning, do you, Dr. Ken Loi?
In my 15, 20 years of career, we've seen procedure comes and goes. There's always things that we can learn new, and that's how we advance, you know. And if you don't look at it, but then I often not the first one jumping to it, because I think we need evidence. We need to make sure that it's work. We make sure that it's not repeating the same track of what lap band do to people before, and therefore I think I need more evidence before I say that yes, maybe we should try that.
Absolutely, I love
But
that.
different procedure. There's a lot of strange procedure out there. Generally speaking, the same rule as I mentioned to you before. The more complex the surgery we do, the more weight you may lose, but the more trouble you can get to.
Yeah.
So often, in the middle is a good balance, which is why the sleeve work.
Absolutely. Now, Dr. Loi, what's one bit of advice you would give somebody who is considering getting the bariatric surgery?
That is very interesting. I would say, do it if you are comfortable. Do it if you have the support. And again, it's the process that is important. And the information out there, there's a lot of them. So, you know, people have chat room. I mean, you set up a very legit, you know, sort of process in terms of giving people a realistic expectation. So I think you can get lost in all this information. So talk to your GP, talk to your physicians or endocrinologists, or talk to the surgeons. I think they can tell you what's possible, what is not possible, and you work it out among yourself, but don't be afraid. I guess surgery itself sounds radical, it sounds dangerous, but once you've been through the process safely, you get what you want, which is probably weight loss and a happy life.
I love that. And last but not least question, what's your best bit of advice for anybody who has had bariatric surgery? So what's the best bit of advice you would give me?
Well, I guess what? Having bariatric surgery is not bulletproof.
It's not.
You've got to be very vigilant yourself. You've got to make sure you're on top of it. Weight management is a day-to-day thing that is going to be the rest of your life. And it's also the rest of our life to look after our patients. That's my philosophy. Some people think that just do the surgery and don't look after the patients. It's probably not the right model. You always go back to your surgeon. You always can ask them questions. I always maintain an open dialogue to my patients. And if the problem that I can solve, I'll solve it.
Yeah.
If it's not my problem or it's not relating to surgical problem, I can always get people to help you.
And here you've got such a great team behind you, Leanne and the
It is a team,
dietitians. So guys, if you're really considering bariatric surgery, I highly recommend to come and see Dr. Ken Loi. You're in great hands. He's going to change your life just like he has me, and you will not regret it. Dr. Ken Loi, thank you so much for answering all these questions.
I'm trying my best to help
He's
patients.
answered very well.
There's a lot of good surgeons out there as well. It's not only me. I'm one person that I've done enough, but you know, I cannot do everyone's operations, but I can help a lot of people. But that's the one thing also, we teach other surgeons, which is the important thing.
I love that,
do the right
Doctor.
thing.
I love that. Thank you so much.
No problem.
Bye, guys.